Hey, BC here for BC Nephro. Thanks for watching. I'm Dr. Brian Cronin, board certified nephrologist and clinical specialist in hypertension. Today's topic, Alport Syndrome. Alport Syndrome, traditionally known as an X-linked disease with manifestations of hematuria progressing to kidney failure, typically affecting men. Contrast this to thin basement membrane disease, also known as benign familial hematuria, a hereditary cause of microscopic glomerular hematuria not associated with kidney failure. However, with the advent and mainstreaming of genetic testing, the relationship between these two conditions and different clinical presentations has become more evident. We're going to get into that, but before we do, make sure you check out the other videos at this channel. Check out bcnephro.com where you'll find articles not only on this topic, but on a wide range of nephrology subjects. I'm also on Instagram at bcnephro. But now, let's get into it. What is Alport Syndrome? Alport Syndrome is a genetic disease involving type 4 collagen. There are 6 alpha chains of type 4 collagen that form basement membranes in the body. The ones of interest to us are the alpha 3, alpha 4, and alpha 5 chain. These form a heterotrimer that comprise the basement membrane in the kidneys, the GBM, glomerular basement membrane, also the cochlea of the ear, and the lens of the eye. Now the alpha 3 and alpha 4 chains are located on chromosome 2. The alpha 5 chain is located on the X chromosome. X-linked Alport syndrome. As this is X-linked, it is typically a condition that affects males, as males only have 1 X chromosome, females have 2. The affected male's mother would be the carrier. There may be a family history with the disease in maternal uncles and male cousins on the mother's side. Clinically, it is manifest as hematuria that progresses to proteinuria and kidney failure. Approximately half of these patients will develop kidney failure by the age of 25, 90% by the age of 40, and almost all by the age of 50. There's also associated with sensory neural hearing loss, as well as ocular abnormalities that can be identified by an ophthalmologist, something called anterior lenticonus and Fleck retinopathy. Now, the females were the carriers for this condition and typically thought not to be affected, maybe having only microscopic hematuria. However, this is not completely true. A significant minority of females, maybe up to 15 to 30%, can develop kidney failure, although they typically develop this later in life. This is because of a process called lionization. Now, as females have 2 X chromosomes during embryonic development, one of the 2 chromosomes in each cell is randomly inactivated. This happens so there's not double the protein production from these chromosomes. As this is random, there will be a mosaic pattern with approximately half the cells having the affected abnormal gene, the affected abnormal gene being the alpha 5 chain of type 4 collagen, and the other half of the cells having the normal gene. Because of this, clinical manifestations can develop, although typically less severe than in males. The X-linked form is typically very clinically apparent, given the severe and characteristic manifestations of kidney failure with hematuria and hearing loss, often with a positive family history. There are also characteristic findings on kidney biopsy. Awareness of the other variants has become more common with genetic testing. Now we'll get into the autosomal recessive form of Alport syndrome. This is typically due to 2 abnormal alpha 3, alpha 4 genes, or 1 abnormal alpha 3 and 1 abnormal alpha 4. As these genes are located on chromosome 2, males and females can be affected equally. The clinical manifestations are severe, similar to the ones seen in males in X-linked Alport syndrome, with the development of kidney failure at a relatively young age and associated hearing loss. Now, the autosomal dominant form of this disease is essentially the same thing as being an autosomal recessive carrier. It turns out that having 1 abnormal gene for alpha 3 or alpha 4 is associated with clinical manifestations, although less severe. Almost all of these patients will have microscopic glomerular hematuria, and it turns out that what was previously referred to as thin basement membrane disease in many cases was an autosomal dominant or autosomal recessive carrier having 1 abnormal alpha 3 or alpha 4 gene. It also turns out that this is not as benign as previously thought. Some proportion of patients with 1 abnormal gene in addition to microscopic hematuria, will develop proteinuria and chronic kidney disease, although typically not kidney failure or hearing loss, and this typically occurs later in life. It has also been noted that a certain percentage of patients with FSGS, focal segmental glomerulosclerosis, particularly that which is steroid resistant or with a family history, will have an abnormality of one of these genes for the alpha-3 or alpha-4 chain of type 4 collagen. Given the increased genetic testing, it will not be uncommon to have patients come to you with the genetic diagnosis of one of these variants of Alport syndrome, typically the autosomal dominant variant. Now, the genetic testing is relatively easy to do. There are panels including a wide number of genes associated with kidney disease. The patient gets a kit at home where they do a cheek swab, just like you would do for Ancestry or 23andMe, sends it back to the lab and gets this report. This has become more mainstream. Many nephrologists will do this. More recent recommendations suggest doing this more often. So it is suggested to screen for these genes in conditions of chronic microscopic dysmorphic glomerular hematuria or proteinuria greater than 500 milligrams a day, particularly if there's associated kidney disease, if there is not an underlying apparent cause. It is also recommended to do these in cases of focal segmental glomerulosclerosis, particularly if steroid resistant or a family history, cases of familial IgA nephropathy, situations where you find the characteristic findings on kidney biopsy of the abnormalities in the basement membrane, or situations where there's hematuria, kidney disease associated with hearing loss or ocular abnormalities. It is also recommended to screen family members for this if another family history is diagnosed with the condition. So that's it. Thanks for watching. If you made it this far, you might as well hit like and subscribe. Please share this video with someone who you think might be interested in learning about this topic. It's spreading the message word of mouth that really helps the channel grow. Leave a comment or question that you have about Alport syndrome, and until next time.